Hello. In this video, we're going to review over the scientific approach to clinical research and practice. This is covered in more detail in Chapter 1 of your textbook. The learning objectives for this section are to define basic, applied, clinical, and translational research, to understand the principles of scientific inquiry, to describe the steps in scientific research and evidence-based practice, and to discuss the scientific basis of professional education and practice. Biomedical research is research that deals with biological and medical sciences to understand and improve the health of patients and populations. There are two types of biomedical research: basic research and applied research. Basic research advances fundamental knowledge about the world. It's focused on refuting or supporting theories that explain observed phenomena. Usually it's conducted in laboratories to generate new ideas, principles, and theories. Some areas of inquiry include biology, physiology, biochemistry, and genetics. Basic research is critically important for applied research. Applied research is applied to develop a product or an application such as new medication, drug regimen, or service. It's typically conducted in animals and other living systems to solve a problem or create a product. Some areas of inquiry include pharmacology, medicinal chemistry, and pharmaceutics. Clinical research includes patient-oriented research, epidemiological and behavioral research, and health services research. Patient-oriented research examines mechanisms of human disease, effects of drug therapies, and other interventions, and utilizations of technologies and devices in humans. Epidemiological and behavioral research evaluates distribution and factors associated with diseases, health behavior, and health in general. Health services research evaluates effectiveness and efficiency of treatment, interventions, and services in real-world practice. All facets of clinical research are important to improve the health of patients. Translational research is the new clinical research paradigm for transferring knowledge across the research and practice continuum. This research includes two areas of translation. First, the process of applying discoveries generated during research in the laboratory and in preclinical studies to the development of trials and studies in humans. The first area is designed to improve the trajectory of research from laboratory to patient care. This type of research is critical for diseases such as cancer and AIDS that are in need of products to cure diseases. The second area of translation concerns research aimed at enhancing the adoption of best practices in community. The second area is supported by scientists, clinicians, educators, and funding agencies to rapidly adopt evidence-based patient care practices. Comparative effectiveness research is defined as the generation and synthesis of evidence that compares the benefits and harms of alternative methods to prevent, diagnose, treat, and monitor a clinical condition or improve delivery of care. The overall goal of this type of research is to provide information to decision makers at both individual and population levels. Patient-centered outcomes research helps people and their caregivers communicate and make informed healthcare decisions, allowing their voices to be heard in assessing the value of their healthcare options. Some examples include assessment of prevention, diagnosis, and treatment options, improving access and care in healthcare systems, communication and dissemination research for shared decision-making, addressing disparities in prevention, diagnosis, or treatment effectiveness, and accelerating patient-centered outcomes research and methodological research. Scientific research is bound by scientific inquiry like empiricism, objectivity, theory, and ethical standards. Empiricism refers to a collection of information based on human experience. It is based on the philosophy of positivism that states that all information derived from sensory experience is empirical evidence of science. Objectivity is that there is no bias in any aspect of research, including definition, measurement, design, and analysis. Theory provides an understanding or explanation of natural phenomenon. Theories often provide a rationale and logic for research question and hypotheses. And finally, ethics. It provides the moral, societal standards for responsible research conduct. The standards are governed by the Institutional Review Board, state, and federal regulations. This is a nice figure that kind of briefly shows the steps in the scientific research process. First, you need to pose a research question and a testable hypothesis. Then you have to develop and implement a research plan to test your question. Then you actually have to conduct the research, so perform data collection and analysis. And then finally, once you have your information, you're going to want to disseminate that to the public, so you prepare a research report. Research can be classified into two broad categories: descriptive, so describes or explores characteristics of a population such as prevalence of disease, or analytical, which evaluates the relationship between two or more variables for the purposes of explanation or prediction. Hypotheses specifies an expected relationship that is being evaluated between an intervention and outcome, or two or more variables. The research design refers to the overall plan that allows researchers to gather answers to study questions and test study hypotheses. The research design can be classified into two branches: experimental, which is considered the strongest design to test research hypotheses, and observational. These are designs like cohort studies or cross-sectional studies and provide the evidence of associations or relationships. Research methodology is the actual kind of how-to manual and how you're going to conduct the study. So it provides details on data collection and measurement techniques. These can be grouped as primary methods, so specific data collection using self-reported observation, biological assessments, for example, surveys or lab tests, or secondary methods, use of previously collected data for purposes such as patient care or reimbursement, like medical charts or medical claims. Statistical analysis provides quantitative answers to the research questions. It's a tool to organize, summarize, and analyze the data. Descriptive measures like means, medians, and modes are often used to summarize the sample characteristics. Inferential statistics such as t-test and analysis of variance are used to make inferences on the population. We will go into more detail about statistical tests and when you use which test in the second half of the semester. Communication tools like abstracts, posters, or papers are useful to communicate research findings to stakeholders such as patients, providers, payers, and policymakers. Reports typically include the following sections, although it could vary: an introduction, methods, results, discussion. In the introduction, this is the section that's going to be a review of the existing literature, kind of set up the study rationale and your objective. The methods is going to be the description of the study design and the research methods and statistical tests used. The results will describe the findings of the descriptive analyses and of the inferential statistics. And the discussion will be an explanation of the findings that you report in your results section. It will talk about how these findings relate to previous literature that was mentioned in the introduction, how it might lead to different future directions, as well as a summary of the study limitations. Evidence-based medicine is critically important. It ensures that the patients are receiving the highest quality of patient care. It involves healthcare providers, payers, policymakers, and what it does is quality healthcare should include things like it should be safe, it should avoid harm to patients from the healthcare delivery, it should be effective, deliver care that benefits patients, be patient-centered, care that's individualized based on patient preferences and values, timely, ensure timely needed care and avoid delays, efficient, care that maximizes use of healthcare resources, and equitable, care that does not vary due to personal characteristics. Science and research is the core to providing evidence-based medicine. Steps of evidence-based medicine, which are evidence-centered, involve asking an appropriate and answerable question, finding evidence to support your question or support the rationale, appraise that evidence, see if it's really valid or not, and apply that evidence to practice. We will cover evidence-based medicine in a separate section. With the increasing pressure of cost and efficiency, there's a need for providers to demonstrate value for their services. Pharmacy profession and pharmacy systems are rapidly changing due to complexities in delivering patient care. With increasing need for evidence, research and evidence-based practices are imperative for new models of pharmaceutical care. The pharmacy profession is based on knowledge and evidence derived from scientific research. Without science or research, none of you guys would be sitting here right now. Sound understanding of the research process is critical for applying drug literature evaluation techniques for evidence-based practices. New paradigms of clinical research are emerging due to payer, patient, provider, and policy consideration. Pharmacists can immensely contribute to research to practice continuum because of their broad range of understanding of basic and applied sciences. I cannot emphasize enough how much the information you will be learning in this course will apply not only to the remainder of your courses in the curriculum, but also in your practice as a healthcare provider. Pharmacists or healthcare providers that do not understand how to evaluate literature, ask research questions, evaluate evidence, and apply that to patient care are going to be very ineffective in providing high quality care to their patients.